So good evening, everyone. I'm Dr. Sarah Makhdoom. I'm a family doctor based in Calgary, Alberta, and I'm the YPC chair for Canada. And this is our first effort to do a webinar this year. So I hope this is useful for everybody. So I have with me today Dr. Saad Yassin. He's the past president of APPNA, Alberta, and now he has moved from Calgary to Toronto. He will be joining us as a panelist. We also have Dr. Amir Aslam. He is the current president of APPNA, Alberta. And there's a lot of things happening in Alberta that you can look into on their website. He will be a panelist as well. Our speakers today are two experienced IMGs, Dr. Wasia Sambreen. She has successfully completed her practice readiness assessment and gone through a long life journey to get to this point. She's a practicing physician and hospitalist in Lethbridge, Alberta right now. And then we have Dr. Sarah Hafiz. She is a family physician, and I think she did her training in Alberta and has now moved to Ontario, I believe, to practice as a family doctor. So everybody has had their life story and journey to achieve success in the Canadian healthcare system. I just wanted to point out that family physicians are crucial providers for continuous care across a person's lifespan and are typically the first point of contact in the Canadian healthcare system. So as such, they are very important, and we want more family doctors in the system. In 2022, we had about 48,000 family doctors across Canada. But in spite of that, there are 6 million Canadians that report that they do not have regular access to primary care physicians. So that is a crisis in itself. And we are part of the solution. And that's what we are going to be discussing today. As IMGs, we are the solution here because we are already trained and ready to go. And we just need a system that is hospitable to international medical graduates integrating into this system. So we will be talking about two pathways today. One is the Canadian Residency Matching System, CARMS, and it's a 2-year residency in family medicine. And then Sarah Hafiz will talk about that. And then Wasia Sambreen will talk about the other pathway, which is the Practice Readiness Assessment Program. And it's sporadic across the provinces. And it's not there in every province, but it's definitely a solution. So she will talk about how she made it through this system and what are the requirements and criteria to get through this. And besides that, there are other smaller pathways that if there is interest later, we can explore those in our next webinar, hopefully. So today's webinar is about family medicine scope. So we are all here as your expert panel to discuss that. And then our next month, we will have another webinar for internal medicine scope in Canada as well. So stay tuned for that. So with that, I would like to invite Wasia Sambreen to talk to us about the practice readiness pathway.
Hi, everyone.
If you want to share your screen.
Yeah, I'm going to share it now. Can you see my screen?
Yes, we can hear you and see you.
Okay. Hi, everyone. My name is Wasia Sambreen, and I'm right now practicing, as Dr. Sarah told you, in Lethbridge. So I had a long journey to reach here, and I will share with you my journey and also tell you about what are the routes you can take to become a family physician in Alberta and all over Canada, which provinces have opened it. So first of all, what is PRA? PRA stands for Practice Readiness Assessment. This process offered by the College of Physician and Surgeon of Alberta, and that's helped you to obtain an independent license to practice in medicine in Alberta and other provinces too. And this pathway, it bypasses the residency program. So it's mean that if you have done PRA assessments, you no need to go back for 2 years of residency program. When you finish your assessment, you are able to get your own license. So today we are talking about the family medicine. Let's first of all talk about Alberta. Alberta, where I pursued my career, and I'm right now working in Alberta. So there's some specific requirement from the CPSA about for when you can apply for this PRA route. First of all, you should get your medical degree listed in WHO World Directory. Number one is that this thing you have to see from where you did your graduation. Is it listed in WHO World Directory? Next, English proficiency exam, which is IELTS or OET. Before only IELTS we have to do, but now they have opened a second option, which is OET, and which is more as per people. I have never tried OET. I have no idea about it, but as per the feedback I got from people, it's more easier to get your desired marks in this one. The next comes you have to pass your qualifying one exam and 2 years of postgraduate training. Or you, if you have not done 2 years of training recently, then you should have been within the last 3 years, you need to have a practice independently or being part of a continuous postgraduate training program for minimum of 1 year in the discipline you want to enter. There are some specific requirement for every PRA pathway in every province. Some provinces have a little bit difference, but overall, in Alberta and Ontario is almost the same. And even in BC, they also want 2 years of postgraduate training before you apply for their PRA route. And when they're talking about the 2 years of postgraduate training, it means they want some specific rotation. You must have done it. In this one is the medicine. You have to work at least 8 weeks. Surgery also 8 weeks. Gynae ops also 8 weeks of rotation. Pediatrics also 8 weeks. Family medicine 16 weeks. Emergency 8 weeks, and psychiatry also 8 weeks. As I told you before, BC requirement is almost the same. The 2-year training required in BC, Ontario, and also Alberta. Even in Nova Scotia, they also want 2 years of training. But BC has something extra than Alberta. Alberta does not want to get any extra after 2 years of training, but BC wants to have 960 hours of independent practice after that training. They don't take care of it's done before. They want, if you have done 2 years of training, and then after that training, you have worked at least 960 hours independent practice, and then TDM exam. But recently, this is something which they demanding previously, but due to high demand now in BC, they have obsolete this TDM exam requirement. So only the rotation and qualifying one, you can apply there now. And let's talk about, this was for Alberta and BC, and then is the Nova Scotia. They also want the 24 months of training in family medicine or general practice with minimum of 8 weeks of rotation training successfully completed in following rotation. Same, there's my family medicine, internal medicine, surgery, peds, psych, ops, and emergency medicine. 2 years training in family medicine plus 2 years of independent practice. Now, this is now where the difference comes from Alberta. And also from BC. BC wants 960 hours. Nova Scotia want after 2 years of your residency program or your 2 years of rotation, they want 2 years of independent practice after post-graduation training. There is another program, which is CIPA, which is in Saskatchewan. And their intake is 3 times a year, and people can get into the system very easily. That's what I heard. Saskatchewan is also another good path to try with. They also need rotation of 2 years, IELTS, and they need some pre-screen application, which they evaluate you, and then they let you know either you are eligible to apply in Saskatchewan or not. And then TDM exam too. At least, along with that, they want at least 24 months of independent practice in family medicine or general practice following completion of 24 months total of post-graduation training or internship in family medicine. Recency of practice in family medicine must include minimum of 450 hours of independent family practice in the 3 years, immediately before the date of application to the college. So if you have not done rotation recently, postgraduate training or 2 years program, then at least you have this, that you have done your independent practice in the last 3 years. So when you want to apply for 2-year training program, so usually we have to go back in our own home countries where we can do this training. Unfortunately, we cannot do it here in Canada. So first of all, you have to apply for eligibility by submitting a review of qualification for independent practice, upload documents on physician apply for verification. After, when you have done your training, so these are the steps you have to go through. So number 1, you have to apply eligibility, then upload your documents, then apply for TDM exam. And this is TDM exam. They qualify you after they review your documents. Then you just search for your job, you look around and secure your sponsorship. So in PRA routes, we need the sponsorship. When I did last year, it was only from AHS sponsorship. They were not allowing any private clinics to sponsor anyone. But recently they have changed this one also. And now before it was only in the peripheries. Right now they have opened in even Calgary, like the big city. They have opened sponsorship program. And now the private clinics are also giving the sponsorship, and then you can apply for your PRA route status. Then you submit your documents and you start with your PRA. So in Canada, there are few hospitals or where their training is approved in Canada for the post-graduation rotation. From where I did my rotation, I went to Fatma Memorial Hospital, Lahore, and I was there for 2 years. And along with my rotation, I did MCPS. That was a chance. So I did my MCPS in family medicine there. And then in Punjab, there is another one, Shifa International Hospital, Ziauddin in Karachi, Dow Medical College. So I had few information about only for the Fatma Memorial, because there I was working and I did 2-year rotation. So there was a program coordinator there. Program director was at that time, Dr. Naif Usman Segal, but right now I think it has changed now. But the coordinator number is the same. Ishtiaq Sam, he is the one who always arrange for and their intake is July and January. I think this is the same in Karachi too, in Dow Medical College. Step after getting your job. So now you have secure everything. You got your sponsorships, you have a job. So now after this, you have to go through with preliminary clinical assessment. This is mostly of the 3 months duration. Then you have supervised practice assignment. This is also 3 months duration. And what is the difference between when we talked about, sorry, I think it's went back. Can you see my presentation?
No, I think you backed out from it. Maybe start the share again. Yeah, we could see it now.
Dr. Samreen is mute.
Sorry about the interruption. So I was talking about this preliminary clinical assessment, which is the first 3 months. I would just explain a little bit more about it. This is the practice where the college decide about your assessor, and you work with your assessor who see you on daily basis. You just see his patient, he review your notes, he see your judgment, and there are many other categories they look into while they are assessing you. Because college has their own criteria. If you go on the college website, you can see those criteria which they are looking for in an candidate while they are assessing, and your assessor judge you on all of these categories. Then comes a supervised practice assessment. In this one, you are not working with any assessor on a daily basis. It's mean you are working at your own, but college decide your assessor, but he comes maybe once a week in the first 1.5 months. And then he take any case and discuss the case with you, see your notes and see your assessment. And then he write the report for every case to the college. So this is the difference between these two. Along with that, there is also option in Canada for some specialties. There you can also apply PRA route, but that also need independent practice in that specialty. Also have to pass the assessment for 3 months. 2 specialty who get in the past, mostly which I know about, gynae, obs, and pediatrics. That's the most common one. Thank you so much. If you have any question, then I can answer those.
Thank you, Gausia. That was amazing. Dr. Saad, you will kindly manage the questions if there are any. Well, let's move on to the next presentation. I welcome Dr. Sarah Hafiz. She is a current practicing family physician. Sarah, you can unmute yourself and share your screen, please. Sarah will be talking about the route through the residency program.
You guys can see my screen?
Yeah, we can see you. And
sure. So my name is Dr. Sarah Hafiz. I'm one of the practicing family physicians. I was practicing in Alberta, Edmonton first. And then I just recently, a few months ago, moved to Ontario. So I went through the residency pathway and CARMS in getting my license. I am an international medical grad from Hamdard University. So let's go on. So there are a few requirements which are like kind of universal throughout Canada. So number one is the exams, which are the same for everybody. That's the QE1 exam and the NAC-OSCE exam, which are required by all the provinces. Then we also have the English language proficiency exam, and I'll tell a little bit more detail, and my colleague, Dr. Samreen, has already touched on that as well. There's the MMIs and the PROC exam as well. And then there's the process of interviews, the CARMS, the match itself. And then I'll just shed just a little bit light on the externship process as well after you have matched to a residency. So the step one, of course, for everybody throughout, like in all the provinces, is preparing for your QE1. And it's a clinical-based MCQ exam. And then there are different dates for it, which you could pick throughout the year. And I cannot emphasize enough that we need a good score on it, being an IMG, because it just makes you stand out. This was the most, I think my scores in my QE1 exams were the most that helped me out with my applications. And then certain programs do have a cutoff where they just don't pick applicants below a certain score. NAC-OSCE, again, the clinical skills and the communication part comes in. It's the oral exam with the patient encounters. Again, you need a good passing score on that one as well. Oh, sorry, I think I went one screen ahead. there. Okay. Then the third one would be the English language proficiency. I'm just going to touch really briefly on that because Dr. Samreen has already mentioned. So there's the IELTS exam, there's the occupational English test. I have not taken that, but I have the same feedback that it seems like it's much easier to do. There is also an expiry on both these exams to just make sure when you take it and when your actual exam CARMS application is going to go in and being reviewed, both of them are valid. There are a few, and then there's the CELP-IP exam as well. And there are minimum scores in each of them. Like I know for IELTS, you have to score a 7 in each section individually. And I just have this like brief slide. This is directly from the CARMS website, where it just kind of tells you which province accepts which. And as you could see, the IELTS is accepted throughout. The OET exam is also accepted. The CELP-IP exam is also accepted in most of them. TOEFL is not accepted anywhere anymore, except for Ontario, maybe. After you've done all your exams and everything, there are certain other provincial assessments required by certain provinces, which kind of vary from province to province. And then these are again links from the CARMS website. You could just go on the, like for BC, there's the UBC Clinical Assessment Program, which you have to go through. In Alberta, they have the Alberta International Medical Grad Program, the AIMGP, and they have their own eligibility criteria, one of which is also like being a resident in Alberta. And then of course, the recognition of the equivalence of an MD degree, like in Quebec, they have their own pathway. So anybody going into different or like targeting a specific province, probably it's a good idea to look at all these, make sure that you have all the eligibility check marks over there. Potential additional requirements like the Casper test, I know that BC wants it. Then the Family Medicine Professional Choice Assessment one. This is, I did not go through this one. This was actually being developed by one of our supervisors in our clinic. And we had the opportunity to kind of test it during our residency, and it was implemented afterwards. Now, something a bit more specific with Alberta. As I mentioned before, you do need proof of status in Canada. That's throughout in all provinces. But in Alberta, you need to be a resident in Alberta. You need to apply through the AIMG program, get their eligibility letter from them before you can start applying to the residency spots in Alberta. So just make sure if you're planning to apply in Alberta, you know what are the eligibility criteria, are you meeting them, and to get that letter from the AIMGP before the CARMS application starts. And of course, like most of the provinces would like your documents to be source verified. There's a website called physicianapply.ca. Many of you might be already familiar if you are applying through the exams, because in order for the exams also, you have to open an account on it and like, get everything verified, your degree, your passport and everything, so that you can get the exams done. So multiple mini interview MMIs. These are sometimes the applicants fear these exams more, but I always found them very interesting. And I would say they're definitely challenging, but they're also interesting because it's like an interaction between you and the patients and how the scenarios kind of are folding up there, like how they present you with the scenarios. So just like the more you practice, the more it becomes easier. My recommendation, my 2 cents would be get a study buddy, practice as much as you can, practice as many scenarios as you can. Try to take, avail the opportunities when the AMGA or the Bow Valley College in Alberta, they kind of have these mock MMIs. So those are really helpful if you could go through them as well. And then the FMPROC is the online 60-minute situational test. It just like kind of assesses your professional integrity, your team working skills, but in an online MCQ and critical thinking manner. I have not gone through it, so I cannot tell you firsthand, but this is definitely something to look into as well. Then comes the CARMS. Once you have all your exams done, you have your scores now, you have met all the requirements on the physician apply, make sure you start very, very early, start getting all your documents verified, especially your degree. It does take a lot of time, especially if you're getting it verified, because they do need it to be sent directly from the university to the CARMS portals. So then definitely get everything in place beforehand. Make a good resume, good CV. Try to attend as many, like if you have the opportunity, try to attend those free CV classes. If you have a mentor or somebody, a supervisor, somebody you have worked with, you could definitely ask them to review your CV. And your personal statement, definitely, that's another thing. My 2 cents are do not overcomplicate it. Just present yourself in it. I went through CARMS myself, and then during my residency, I had the opportunity to interview many residents who were incoming. I reviewed their files as well. I was on the interview panel as well. I recently conducted interviews for the medical admissions, the MD coming class for University of Alberta as well. One thing that we all felt like, and I know there are more seniors here who can chime in, that was like, the more, if you get that feeling of, okay, this is an honest kind of personal statement, this is what he's telling us, he or she is telling us their story, that just kind of clicks with the examiners more, and they can pick when you're telling what actually happened versus what actually did not happen, or like just don't over exaggerate anything. Then comes in the reference letters. During your journey, definitely work on that. I know many IMGs struggle with the fact that you've done your like your medical education, and then there's a gap in between. Try to do something, whatever you can, whether it's a community work, whether it's an observership, even if you're just going once a day, go get it done, so that you're doing something in a continuous fashion. And then get those reference letters, get your referees, like give them heads up much more beforehand, so then they're ready, they can make a letter for you, because there are timelines for these things, and you do want all this paperwork and documents done way before CARMS portal actually opens up. Because once that portal opens up, I would say the anxiety level shoots up, and then if any of the documents are pending, that can be really challenging at that point. So just get these documents ready beforehand. And then, of course, all the other things that go in the CARMS portal are, many things will be just pulled from your physician apply account, so you don't need to worry about those things, such as your exam results, your assessments, your citizenship documents, your medical school transcripts, medical school performance record, or the dean's letter, which we used to call it. All these things, most of them will be pulled up from the physician apply as soon as you give consent to the CARMS portal. I do remember that the dean's letter or the medical school performance record is one that they do require directly from the university. So definitely, even before the CARMS portal has opened up, like way before, months before, if you're sitting here in Canada, you don't have a contact back home, try to get in touch with somebody, get to know how to get this document. So once CARMS portal is opened, you can just let them know and give them the route, and they can send it. Some schools do it online. I know that Al Khan maybe does it. I think Daw University does it online as well, but some don't. So if yours doesn't, then you need to work on it way much earlier. So now you've sent everything in CARMS, you've sent your application, and if you're lucky enough, definitely you're working for your interviews, and hopefully you'll get as many as you like over there. But then, of course, you have to prepare for those interviews too. Attend to the mock interviews, practice as much as possible. Know your personal statement, because the people sitting in front of you taking those interviews had gone through them, had gone through your CV. And believe me, they do ask you questions from your CV. They might have things highlighted over there. We used to do it. We would ask them, like, if something like really interested us in their CV, or if we were like, curious about something that they had mentioned on their CV. So you should be ready, and your CV, it should be just like at the back of your mind, where you know what you have done and what you have written in it. Know the CANMED roles. I cannot emphasize less. That's going to be a part of your career throughout medicine, whether it's your residency, whether it's your practice, wherever you go, the CANMED roles are going to haunt you and they'll be with you all the way. And definitely relax the day before. Be yourself on the interview. Once you've done your interviews, the next step is the rank order list. The rank order list, again, this is also, some of it is from the CARMS website directly, just like, reflect your true personal preferences. They do say to apply to programs that you really like and want to attend. But my 2 cents as an IMG would be, apply as wide as you can. Once you get those interviews, rank every single program. Unless there's a program you're like, this is where I'm never going to go no matter what, then do not rank it, because it's going to be a binding contract. Keep in mind that there are certain provinces which have this return of service contract as well. So match day, if you match the first criterion, congratulations, you matched. The journey isn't over yet, but yes, the main part of it is. If you did not match the first criterion, take a deep breath, relax. There is a second criterion. I did not go through the second one, so I'm not sure how exactly it works, but I think whatever remaining programs are there, you still have to be in that IMG stream, but you can then start applying over there. This post-match process is also new. It was not there when I applied, but then you can apply and participate in it. I think you have to contact the programs directly because the CARMS does not regulate this one. So once you've matched and you're in the program, you have your, you've done through all of this. So it's, most of it is over, but I would like to touch base a little bit on the externship part, especially in Alberta. It is a 2-month process. I found that this was the most challenging and most anxiety provoking for most of the IMGs, because now you're sitting with a seat, you have your spot, but you also know that you could still be kicked out if this does not go right. So just be prepared for it. It's 1 month of internal medicine. I don't know if they have increased it to 2 months. There's a 1 month of family medicine clinics. Everything counts. Your case presentation etiquettes, your management of common cases, how you conduct yourself, how you react with the co-resis, how are you reacting with your supervisors. These are some of the books that I went with. And I would say the senior residents and the mentors, you are assigned a mentor when you are going through that externship. They were a blessing, a lifesaver. Go and approach them. Most of them are very nice and they can help you through. They're very they're there to help you, not to assess you. And mentors are most of the time IMGs. So they are trying to help you the most over there. There are a few other, like in other provinces, there are a little bit different IMG orientations. I don't have first-hand knowledge about them, but I do know that in BC, the IMGs do participate in a 1.5 week long orientation, which is hosted in Vancouver. How actively they are being assessed is different. They call it an orientation. Though in Ontario, there is a pre-residency program or the pre-residency program for the family medicine. It is conducted through the Touchstone Institute. People who do get matched, they go through these programs. They are kind of similar like in Alberta because you're being assessed in them as well. Manitoba also has a mandatory 2-week orientation program. It's just kind of an orientation from what I have heard. It's not an assessment, but unless you do something really that gets flagged off. And then, of course, most provinces have a return of service contract. Like I know Ontario has a 5-year contract. Alberta did not have any contract, so you could just go and practice anywhere. Return of service just means once you're done your residency, you're bound to go and practice in a certain place for a certain time period, whatever the ministry tells you. And these are the sources. You could just go directly on them and go and explore everything in there. And best of luck. That's about it.
Thank you, Sarah. That was really amazing. I think you covered all the important points. Very well done. May I ask Dr. Saad Yassin? He is the co-chair for the Young Physicians Committee, and he will, I think, ask the questions that were posted. And once we've dealt with those, then we can go to people raising their hands. Thank you.
Thank you, Dr. Sarah. So I have a question. I would probably think Dr. Samreen may answer. How difficult is clinical assessment? Can you rate it?
So clinical assessment, first one is a little bit challenging because you are working every day with your assessor. And as I told you before too, they assess you on your manners and CanMed rules, as my colleague, she also told you about it, CanMed. This is very important. It's not, I will not say that this is impossible. Sometimes depends upon the assessor too. Some assessors are very kind. Some are a little bit, tough, but it's not impossible. Most of them, they are very kind and they judge you and they pass you.
Thank you. The next question, I think Dr. Sarah Makhdoom may answer. The question is about the sponsorship. If I would like to practice low-risk obstetrics, can I work with a sponsor who does not see obs patients, but is willing to include that?
So you will actually have to work in a low-risk maternity clinic to get the appropriate references. And people who don't do maternity care, I don't think they can vouch for you as a sponsor.
Thank you. It makes sense. So I've got a question about the QE1 scores and Nakoski's. I think there's more than once has been asked, how likely is it to match with an average QE score? And then there is, which is 250, according to this anonymous attendee. If you score high enough in Nakoski, so again, how likely is it to match with an average QE1 score 250 if you score high enough in Nakoski? And there is a similar kind of question that has been asked before. How important is the score in Nakoski or MCQE1?
Well, the first question that says that if you have an average score in QE1 and then a good score on Nakoski, I would say it is highly variable because they don't only yes, good scores do matter. They do make your application stand out. And in some instances, some universities would have those filters set up where if the score is below a cutoff, they will not even consider or look at your application. But once you've made that cutoff and you're there, I think then it's the overall application that matters, right? Whether it's your next OSCE score, what you've done otherwise, your observerships, your reference letters, then it's like a pool of everything then.
Thank you. So basically you do your best, you get the as high a score as possible, and then leave it for the rest of the skills and experience. There is a question about CV classes, if there are any links for CV classes available for both the PRA and COMS, then somebody wants to know. The next question is, how badly will it affect your application if you are not able to get MSPR to apply for the residency program? Perhaps for Dr. Sarah Hafiz.
Yeah. So every program has their requirements, right? And most of the programs, when I applied, because they're getting tons of applications, they're like, you're getting thousands of applicants. So they may not even consider an incomplete application, depending on, like, you have to go on individual programs description and see what is mandatory, what is optional, and what are they saying, like, may or may not consider kind of a thing. Most of the programs, if they're saying this is mandatory and you don't have that particular thing, your application will not pass through the filter. So it will never reach the desk. That's what I think.
Thank you. And the next question is, I never heard about mini, I guess, MMI interview and family medicine proc. I guess it's because probably you've not got to that stage, because the mini interview is one of the last step that you are called for interview. It's a kind of an interview process, like an Ekoski, I guess, stations, but it's more kind of a direct question and answer, looking for your communication skills and critical thinking. Is that right, Dr. Hafiz? Or maybe Dr. Samreen even can answer.
Yeah, sure.
Yes, that's absolutely right. This is something which comes after, at the end, MMI, and then they judge you. But Dr. Hafiz definitely can tell more about it because she has gone through that part.
Dr.
Well, as
Hafiz.
I said before, MMI is like one of the very last things. They do have dates for it, and then you have to apply. Everybody who's going through the CARM cycle will get a date as long as you apply by that deadline. They try to accommodate everybody, but the exam expires every year. So if you're applying this year, you took the MMI, you got a good score, you'll be doing it again next year. It does not count the next year, so you'll be doing it again. It's not like a QE1 or NACOSCI. And it's like mini mental interview. So it's usually nothing to do with your medical knowledge. It's more of your like team solving, problem solving, those kind of ethical issues that they are looking into.
Dr. Sadia Seen, maybe we can have Dr. Amir take some questions as well.
Yeah, sure. I have a question for Dr. Wasia Samreen. Just for the audience, that I also came through PRA assessment, but it was from UK, so our training was in UK, so we didn't have to go through the first 3 months of assessment, which you're talking about. So it was directly waived to the second assessment, um, uh, which was actually only for 15 days at that time, at least for me. So my question is that in our training in UK, it was very long training, 3 years, and after that, of course, we worked as a family doctor there, and so the scope of practice in Canada is so wide, and of course they prepare for you in residency training in Canada and also in UK. I did do my house job in Pakistan, so the scope of practice is different in Pakistan. So of course you did the training in Fatma Jinnah and did all the rotation. So my question is that did you do anything extra before your assessment, the first 3 months assessment, that you have to do extra training here in Canada to prepare yourself, or you were confident that you'll be able to go through from day one?
So actually, before going to Pakistan, I was trying to do the same path as my colleague. She did the CAMPS path. I applied first, I did not go through. So then I decided to go to Pakistan. But before that, I worked here as an assistant too. So that's why I was very much familiar with the guidelines in here. It's almost more than almost 2 years I worked here as an assistant in a clinic. So I think this is required. If you are not well aware of the guidelines here, it gets a little bit challenging when you go for your first assessment. But if you need to shadow someone, you need to work with someone before you go for your assessment, and everyone do it if they have not done before their assessment. That's the way they get familiarized with the system, AHS system, and what are they are looking for. And I think this is 100% recommended that before you go for your assessment, you should go either shadow with someone or work as a clinical assistant, or whatever way you can, find some work that's either volunteer work. Even for my before I went to Pakistan, I worked, but when I came back, I just volunteered in the clinic almost 7-8 months, and I was just working on daily basis, just voluntarily, so that I know more about it and I can more chance to get passed in the assessment.
Sure, thank you. I have a question for Dr. Sarah, please. So congratulations, mashallah, so you're working. I mean, we all have done hard work beforehand. So my question is, as you mentioned about the good scores in application for, we need good score in QE1. So these are the requirements. Apart from the QE1 score, is there anything else a candidate has to do to stand out?
Yes, sure. I think there are a lot of things that you could do to stand out, and everybody's CV is going to be different. Everybody's, I would say, highlight is going to be a different. Like I'll just give you a few examples from the interviews we conducted. We used to look at like what other than, like, let's say if you are an IMG and you cannot get into medical practice because of the licensing restrictions, how did you avail that time? Were you doing community work? Even like we had even sometimes you would get candidates who would just be honest, and they will be just telling us we had 3 younger kids, we were taking care of them and we raised them, and this is what the way they presented it, it seems like it is an important task as well, and that's what they were doing, right? And so whatever you're doing, you should have a good rationale and like the way you present it to them, whether it's community work, whether you're volunteering at the mosque or some other religious place, or whether you're like teaching voluntarily, or anything that you're doing other than medicine, right? If you are doing your observerships and getting shadowing work in the hospitals, how you presented that also counts, right? To highlight your experiences, let them know what you did, what you gained, what you learned.
Thank you, Dr. Sarah. My last question to Dr. Samreen, and then I'll hand over to Dr. Sarah. So there are many IMGs here, and which at least personally I met, and you guys must have met, that they have been trying to get into the system, and there's a lag behind so many years that they have not done any medical related work. But instead of that, they just keep applying year on after year, either COMS or PRA, trying to get into the system. So what would you advise for them if they want to achieve the goal through the PRA route and they are unable to get into via COMS pathway, and they keep trying every year, and they already passed through so many years, and they have less hopes now because there is a gap in between now. And as you mentioned, every pathway there is a requirement that it has to be fresh training. So what you advise to them? They lose hope and not to apply, or what else they can do?
So first of all, my advice is do not think it's impossible. Everything is possible. We have to be just consistently try hard and then leave to your God. And that's all we can do. And I'm in front of you. I worked many years, struggled many years. I had a gap too, because when I came in, I have 3 small children. And the same way, as Dr. Sarafiz was telling, so I was taking care of them. I was at my own, and I was, studying my exam. Within 3 years when I came in, I passed everything. I did all exams. So, but I did not left behind. I did not stop at any point. Either I was doing volunteer, either I was doing an assistant job. It was very low income job, even if it's like $15, but I was doing something all the time. So don't lose hope. it's not impossible. And this is now, I will say, it's a very, very possibility, because nowadays demand everywhere. Even in BC, they are struggling to find family physician. Ontario and Alberta, still there are many patients, many people who have no family physician. So just constant with your, struggle. Don't lose hope. Try your best, whatever you can do. Either is shadow, just show something, and then you will get it. And I know it's difficult to go back, and it was very hard for me too when I went back for 2 years. I left my kid and my husband were here, and I was just at my own when I went to Pakistan. So, but every hardship pays. It was very hard time as a mother, leaving the kids behind, and also without husband, and you're staying alone in Lahore, where I never stayed in my life. So, but you have to do little work hard for sure to get that, and then it's all paid. So my last advice will be the same, like, do not think you cannot do it. You can do it.
Thank you, Dr. Wasim. Back to Dr. Sarah, please.
I'm just scrolling to see if there's any questions left.
So in the meantime, I'll just touch base with one thing. As Dr. Sarah Makhdoom initially said, there is a crisis of family medicine and family medicine, and a shortage of family physicians, and this is across Canada. I just want to mention some numbers, just to give you an idea that there are 2.3 million Ontarians who do not have family physicians. As of March, 108 family medicine training positions out of 560 in Ontario were vacant after the first round of pairing. This is a sharp rise from 61 unfilled positions in 2022 and 30 in 2020. So again, people who are trying for CARMs, this is a chance. And this is a record highest number of positions that has been filled through the CARMs process for IMGs at least in McMaster program in family medicine. So keep working hard and keep trying your best. There is a chance. And I was reading this. There was a study published in Medical Journal, Canadian Medical Educational Journal in 2024, this year. And this study looked at the characteristics of IMGs and factors related to successful matching to IMG spots through the Canadian Residency Matching Service. The study found that in 2019, 14% of IMG applicants matched on the first attempt, 6.4% matched after 2 to 3 attempts, and 2% matched after more than 3 attempts. So there is always a chance, as Dr. Samreen said, keep persistent, stay focused, and be patient.
So we've had a hand raised for a while. Salma Sultana, would you like to ask us something directly? You can turn your mic on.
Hello.
Yeah, go ahead.
So yeah, I asked my questions in the Q&A. So my question is again the same thing. I don't, so the PRA route is not for me. I don't have the residency, neither I have the independent practice. But then I was thinking of, applying for clinical assistant. And now they have the criteria of only 6 months of recency. And then that I got it when I went back to India last year, and I got it 6 months. Now I have the pre-screening letter, I have everything, and I'm applying. Okay, I'm applying widely all over Alberta, like be it anywhere, Red Deer, Lethbridge, Edmonton, anywhere. But the thing is, I am not getting interviews. Like I am also in contact with others on telegrams. Like I don't know them personally, but we message like, is there anybody who is applying for clinical assistant or anything, and they do reply. So somehow they are getting the interviews, I am not getting the interviews. I don't know what I am doing wrong. Like why is it like they are getting at least like So the girl I'm talking, she's getting at least 5 to 7 interviews she got so far. And I got one interview from Royal Alex. And after that, I did not hear from them. And I'm not getting any more interviews. So I don't know what I am doing wrong here.
Thank you, Salma. So,
Can I answer?
Wasia, do you want to address that?
So Salma, why the others getting the interviews, why and you are not? As I was also, I'm working in a hospital right now. Our staff, they were also looking for some clinical assistant. I think the main thing is the cover letter. You have to work hard on your cover letter. That's the thing which immediately tells what they are looking for, and your CV. These are the two main things. Especially the cover letter is very important, because nobody is interesting to see your CVs, maybe two pages or 3 pages. Cover letter should be up to date, like it's very comprehensive, very good. And then you get the more chance to be interviewed or getting chance to get job. That's what my understanding for this.
And you can ask somebody in your community to, or somebody who's working to have a look at your CV, and that might help as well.
For this one, AMGA, they offer your CV, also they check. There is also some people who always look your personal statement. They also look for your cover letter, and they help you to correct it. I think to get help from there is a very good idea. Go to AMGA, and they are very helpful people who are sitting there, and they can change everything for you.
Okay, thank you so much. I did not knew this about cover letter, because for the first few jobs that I applied, I did not even attach a cover letter. But now that you're seeing that cover letter is the one they see, so I'll start working on that. Thank you so much.
Welcome.
Thank you. So next question is Nemat Alia. You can unmute yourself.
Oh, hi. Can you hear me? Hello?
Yeah.
Yeah, first of all, thank you everyone for great presentation and information. And my question is that is a hybrid work acceptable? Because of what happens usually, like I do online job for my home country. I just meet like work with my patients and work like in the online. But when summertime, I just go one month and 1 month and a half I spend there. Usually the rest of the time I'm in Canada, but doing online. My just simple question is, it's called hybrid work, right? Is it acceptable? It would be acceptable, like PRS for hours.
I think if they knew that all of your work is online, then it might not be acceptable because you need hands-on patient care other than in emergency situations like the COVID pandemic and things like that. So I would suggest that you do at least 3 to 6 months in your home country to show recency of practice. That would be ideal.
Okay, thank you. Thanks for answering.
One more question about how important is research. Dr. Hafiz, do you want to address that one?
Well, I would say that research is also just like a part of the puzzle. It's not like as if you don't have research, your chances are very grim. Or if you do have research, then you're going to just outshine everybody. I think it's just part of that bigger puzzle where this is like one more thing that you can add on. And if you have that research experience, very good. But then what would really matter is that the supervisors in research, are they willing to give you an outstanding reference letter highlighting what you did over there? I think that will make you really stand out. Just putting it from this date to this date, I did research, may or may not help you that much.
There is a question about Saskatchewan family physician position. As a specialty physician, how much chance to get Saskatchewan family physician position? Dr. Samreen? through the
As per
PRA?
my understanding, it's a very good chance in Saskatchewan because they take 3 times their application open, and they did pre-screening letter, which pre-screenly they check you. There's some documents they required it, and if you are past pre-screen, and the chances to get in Saskatchewan is quite bit high.
Thank you. And then there is a question again. How many questions can we take more? What are we doing? How are we doing with the time, Dr. Sarah?
I think we're okay. We're only 7 minutes over. So yeah, we should keep going if people have questions.
Okay. Can one apply straight to the second iteration without applying for first iteration? Dr. Hafiz.
I would say double check on the CARMS website, because it's usually that you have entered, like at least for family medicine, you have to enter the first iteration, I think. And then it's only the people who had not matched and are in the CARMS system are given access to those unmatched positions. Because I do know some of the colleagues who did not enter the first, the first iteration in CARMS did not have any access to the second one. So I'm assuming they were not able to apply in it, but definitely double check on the CARMS website whether you could or could not. And I think it also varies a little bit with these specialties as well.
Thank you. Is there a benefit having LMCC?
LMCC. So I don't think LMCC as such exists like that existed before, because before you needed your QE1, your QE2, and then you will get that LMCC certificate. But with the pandemic, they got rid of the QE2 and then just gave everybody the LMCC. So it's not a requirement for CARMS. If you already have it from beforehand, definitely they will pull it from your physician apply account. But I don't think it puts you on a back foot if you don't have it.
QE1 though is a must, I think, for applying to residency.
Yes, QE1 is a must, but then the LMCC was kind of a certificate you would get after finishing QE1, QE2, and NACOSCI.
Yeah.
So I think that's obsolete. The LMCC thing is obsolete, but QE1 is still there.
There's
Okay.
one question about,
Yes,
sorry,
Dr. Amir, go ahead, please.
there is one question about somebody is the anonymous attendee. So he's already got matched in CARMS, and he also got the invitation for the PRA. So he's asking what to do. Dr. Sarah.
So it
I would
depends
say
on their level of experience, really. If they're very confident that they can pass the PRA process and they meet the criteria, then go for it. But if you have not done your house job or, at least 2 years of practice, then I would suggest that they go into the residency program. And did they share which residency they matched to?
No, I presume it must be family practice, but we don't know that part.
Yeah. So anybody who matches to a residency program should consider themselves very lucky, because it's, less than 0.5% people who match to a residency, and even less that, make it through the externship and then on to actual residency as well. I hope the statistics will keep on increasing. Sarah, you have some numbers on that?
I don't have a number, but I don't have any recent numbers, but I would like to add one thing. I think they need to double check over here, because if they have matched to a position, that's a binding contract. You cannot back out of it, which means you'll have to let go the PRA and you'll have to go for that match. Once you match to a position, that's binding for you. You cannot back out. That's my
Okay.
understanding. So
Yeah, that's a
definitely
good
double
point.
check on that. Otherwise, you may end up losing both if you just went for PRA and ditched the residency.
Yeah, that's very true.
Very well said. Okay, I think it's pretty much the same question. Hello again. I have a question about family medicine Saskatchewan, independent practice position, specialist. How much chance for this position? I think that's been answered. Is it correct?
Yeah.
Can you suggest resources to prepare for QE1 and OSCE?
Or there are tons of resources. You just go on the QE1 website, and they have their own samples that you can go through the sample questions and everything. When I was going through it, I did avail the Canada Q Bank. I didn't find it that helpful. I had just like side by side taken my US MLEs, so I was doing the U World Bank. So I just stick to that one. Some people do recommend that it prepares you more than it's needed for the QE one because the MLEs are more tougher. So just pick any bank, Kaplan, USMLE World, or the Canada Q Bank, or the official website, and then just try to do it very thoroughly.
Okay, the question is, I'm currently doing 4 years residency in family medicine at Indus Hospital, Karachi. Which pathway do you people recommend in order to work in Canada?
For
Ahmed,
this one,
do
I think
you want to address that one?
Sure, if it's approved training center from the college, that's where they need to check first for all the residency training, first of all. Or at least for the PRA, but definitely can apply for COMS. Dr. Ahmed, do you have anything to add on that? Or Dr. Hafiz?
Yeah, I would say that there is no harm in checking with the college. Even if it's not approved center, I come across at least a couple of people that college has accepted their sporadic training, actually, different hospitals. And because there is a need and they are looking into individual cases on case by case basis. So it's up to the committee. If they decide that your training is acceptable, they give you the eligibility letter. So if you're in approved training, or approved means at least a residency training for family practice, you should actually reach out to the college to see what they say about your training. Then it would be the PRA pathway, like Dr. Wasia already gave presentation.
yeah, for in this one, I will add a little bit more about it because I know some people who did training before me, like half part did from one college, half part did from another one. They just want to know that when you apply for eligibility, and most of the time they check everything from back home. They want your logbooks, they want your exams results. If the college is that's eligible enough, they provide everything, then they accept everything from there.
Thank you. I think there's a general question about what are merits of practicing in Ontario comparing with other provinces. It depends on so many things, your circumstances, I guess. Any take on?
I've never worked in Ontario. I hear it's very expensive, so more living expenses.
I think that Dr. Saad can tell that as well.
No, that's true. It's expensive to live in Ontario in terms of the house prices. Other than that, I see it's so many advantages as well. It's very close to the world, right, and to the south. Big immigrant population, so and plenty of jobs. And it depends on of course what stage you are in for PRA. Ontario is open for PRA the first time this year, so you might be lucky to get in there. So I can say anywhere you feel at this stage, if you are starting your career, any province, I think it's a good start.
So there is a slight difference in Ontario, the pay scale wise, as compared to Alberta, because some of my friends, they are already moved from here and they're working now. Like if I have seen one patient here we can use the time modifiers. In Ontario, they are not allowed to use that. They just go for basics. The number of patients is not at all limited in Ontario. You can see 100 patients if you want. But here we can use a modifier. There they cannot. So there is slight difference in that part too.
So
Thank
we
you.
can maybe do another webinar at some point about practice differences, but yeah, it's not part of our discussion today. So let's see if there's any more questions in the Q&A.
So there are questions about cover letter. What should we write in cover letter? A question about any links or sources for CV. I think that's probably relevant for that. And that could be another webinar we could do. But if there's anyone who wants to answer.
Which question, Dr. Saad?
What to write in cover letter, and any links or sources for CV classes.
For cover letter, they wants to know why you are applying for this job, why you are interested in this place. If I'm applying for Lethbridge, why I want to go to Lethbridge, and what are my main strengths, which are more dominant in me, which they are looking for. It depends upon the job application, like job posting. Look at the job posting, and then you can make your cover letter, make your strength more obvious in them, and also about your interest in this place or interest in this job, why you want to go there. That's the main thing they look for.
And I guess for comms, their structured kind of expectation from the application that they will mention in the cover letter. I guess one has to pick those cues as well. Thank you so much, Dr. Samri. I have done 2 years of residency in pediatrics back home. Can I apply for PRA? Again, I guess you need to do family medicine. You need to do other rotations as well. You definitely can apply for review, and they will advise you if you need to do some reduced months of those rotations, or just follow the rotations depending on the province you're practicing. Is that correct, Dr. Hafiz?
Yeah, that's right.
I think Dr. Samreen may be able to shed some light there for the PRA.
Yes, Dr. Samreen, do you want to add?
No, I think you have told correctly. Yeah, this is the way. They have to apply for eligibility, and the basic requirements, you have to go to the PRA route for that province, look about their requirement, which is almost the same for everyone, like the main domains where they want you to have practice. Go for those rotation, and then you can apply for your eligibility, and they can let you know, that the college will let you know if they're acceptable or not. Online is not at all acceptable in this case. Like when I went to Pakistan, their COVID hit in between. So in between, if we had some period of online during that COVID time, we have to complete it all in person after that. So I worked in Pakistan more than 2 years just to fill up that gap of COVID.
Thank you. So we have a question, couple of questions quite similar to this one. Can I hope for comms pathway with MBBS and 6 years gap? I have clinical experience for all these years. Currently in Canada on student visa, healthcare administration. Kindly advise.
I don't think you can apply on student visa because you do need that proof of Canadian residency, either a PR or a passport. other than the gap part, I think there are many IMGs who matched, even though they had like graduation years way before. But I think the proof of residency is a must.
Okay, similar question. I did 10 years back house job from Pakistan. I don't have any research or clinical job, did nothing related to medical jobs. If I go for MCCQE1 now, is there any chance to get matched, or what can I do to make my CV?
It might be better to go back home and work for at least a year and then come and write the QE1 exam, because the questions are very clinical. And if you've been out of practice for 10 years, you will not be able to answer those questions.
Agree, and I think there is a currency time here as well. Plus, if you're going to do certain training, you could do a family medicine training from approved center again, and you can apply for PRA pathway. That's a very good route for you, probably. And on that note, actually, I just wanted to mention that there are the PRA pathways is being explained in this webinar. But there are certain kind of candidates like Dr. Amir and myself as well. And there are doctors who are coming from UK. So you might have heard, or you'll be hearing that people are coming from UK or Ireland. They are bypassing certain requirements through the PRA process. And that's because they have done a long training there, and they have done the specialty exams, which is the MRCGP, and which is equivalent to the CCFP exam. So I think they've done too much. What's the requirement to actually do an independent practice without any assessment? So they are not required to do the assessment or any exam. So that's another way of coming to Canada if somebody is young and they just graduated, and they have some ties in those countries. They can just get the training there and come over through the pathway without any exams or clinical assessment or supervision.
So there are certain countries that they fast track into Canada, people that trained in the UK, Australia, USA, and I think there's a couple more. South Africa, probably.
South Africa, Ireland, I think it's Hong Kong. They added Hong Kong as well. Singapore, maybe a couple more.
Yeah. So keep looking at the websites, because they do add more every year. There is no age consideration for applying for residency in Canada. So I had residents who are like 42 years old, 50 years old. So as long as you have the strength to run around the hospital and, work in ICU like the rest of us, then you'll be okay.
There's one question about 8 years of experience as a medical doctor, currently pursuing family medicine MCPS, experience-based, but no family medicine training. Which pathway will be suitable? I think the basic requirement is perhaps the training.
Yeah.
As far as I understand, Dr. Ghasia, is that right? That they need 8 weeks of training in all the specialties plus 16 weeks family medicine.
CPS
That's
is a
CPS is
right? Sorry, who was?
Dr. Ghasia, please.
Yeah, that's totally right, because they need certain training. If you are working as a family physician somewhere and back home, or if you're doing MCPS, sometimes the little bit change in the the requirement fields but they want particularly the fields they have mentioned on their website. So just make sure if you have done those rotations, you are good to go.
And there is a comment for PRA, Nova Scotia have more options for countries like UK, South Africa, US, etc. Please explore that option. Thank you. I think that's all the questions we have. Dr. Sarah.
If you're looking for us, then we are on Facebook as APPNA Canada Young Physician Group. We don't have a website so far. APPNA has a website, which is a North American Association, and APPNA Alberta has a website. Amir Bhai, do you want to share that one?
Sure. Even if you Google APPNA Alberta chapter, it will come up. It's appnaalberta.ca. But that is only APPNA, that is Alberta based, but you'll be able to find. There's as Dr. Sarah Makhdoom already mentioned, APPNA Canada, YPC, Facebook is there. That's something you can join as well.
So do join our Facebook group, because we will be starting some mentorship guidance on there. And we will share a Google document in the next few months to get the names of people who are interested in being mentored. And we will match you with somebody who can guide you. So do share your town or city or province, wherever you're in. So I think this is great. Thank you so much. We had very good attendance today, and our next session will be about internal medicine scope in Canada. So I hope that more people will join over there. Thank you, Dr. Saad, Dr. Amir Aslam, Dr. Sarah Fiz, and Dr. Wasia Samreen. You spent your evening imparting knowledge to people who really need it. And I hope this triggers some more people interested in the Canadian healthcare system and try to match the criteria that are needed here. So thank you, and we will share this on YouTube. It will be on the APPNA YPC page, and you can log in there in the next week or so. I hope that it's up there by then. Thank you very much, and good night.
Good night.
Good night.